inviting me. What I was planning to do is to take a look at how we went about building, because we have a sizable portfolio for treatment as prevention, give you some background about how we actually built the program, what were some of the initiatives that led to the current portfolio, and what are some of the future directions that we're considering along those lines. First of all, just to give you an idea of the type of areas that NIDA is supporting in terms of HIV drug abuse research. We have a substantial behavioral social science. It has a lot to do with the history of NIDA, which came into the NIH in 1992 and was part of a different agency prior to joining NIH. So we had been supporting large-scale behavioral research in the past. One area that's growing is the etiology and pathogenesis. We used to have a lot less investment in that area, but that area has been growing in the last 5 years or so. But keeping that in mind, before we started various initiatives within the treatment as prevention modality approach, we had already been tackling some of the issues, such as using outreach to recruit a very high-risk drug-using population, including non-injection drug use. We were not just limited to doing research on IDU, and also in criminal justice. We're one of the leading institutes at NIH with regard to our criminal justice portfolio, and as a matter of fact, you're going to be hearing from Shoshana this afternoon, or this morning, I forgot which one it is, about the criminal justice program. Also, we had been using drug treatment as HIV prevention, looking at how can we engage people in a drug treatment program and reduce their risk for acquisition and transmission of the virus. The first major step that we took towards building our treatment as prevention program was with awarding the Avant-Garde Award to Julio Montagnard back in 2008. Which was the first year that we put this program in place, and we had 4 awardees that year, and Julio actually got the award for implementing treatment as prevention. Right after that, we issued various supplement programs to different investigators to do some modeling within the criminal justice system to see what kind of impact we could have into that area. And following that, we issued an RFA, which is set aside money to try to get applications. We're basically calling on applicants to submit research projects that would be addressing treatment as prevention within the criminal justice system. We awarded 12 grants as a result of that initiative, and this slide depicts where these grants are actually taking place. Right after that, the following year, in 2011, we issued another RFA, which was trying to have people look at vulnerable population across the world. And for this initiative, we funded 10 different research projects. And you see here where there's quite a few of them are actually international projects, although it was not calling necessarily for international, but we were surprised to see how many we got in response to this initiative. Another initiative that took place the following year was in collaboration with PEPFAR, where we were looking at implementation science, and of those projects, we awarded 7. Of those projects, 5 of them involve seek, test, and treat and retain, or a component of seek, test, and treat and retain. Those 3 initiatives and the supplement program basically was the foundation of us building this portfolio. We have other programs that are in place currently that just started in the last year or so, dealing with the CTN. NIDA CTN is the Clinical Trial Network at NIDA, which is a large program where we carry out various trials. And 2 that pertain to seek, test, and treat were recently launched. One is the Project Hope that looks at recruiting patients from hospitals and linking them to care and sustaining them in care. Another one is actually looking at implementing a better testing and linkage to care within various Chinese hospitals. I think there's 21 hospitals involved in this project in China. Other large project that we just initiated this year as a result of a PI-initiated application is a large community trial looking at all elements of Seek, Test, and Treat in Puerto Rico, which happens to be the only region in the United States that's still, where the epidemic is still driven by injection drug users. And this project has been initiated this past few months. Over the years, if you look at the active Seek, Test, and Treat projects that are underway and active in a given year, you'll see there's been a consistent growth over the last 5 years or so. If you start looking at which component of the Seek, Test, and Treat paradigm these different projects are involved in, you'll see that there is a lot of rapid growth, especially in the area where you're doing and addressing all the different links of the Seek, Test, and Treat. Another way of looking at it is to look at the orange segment. Start with at the beginning in 2007, we didn't have many projects that were looking at all the components, but in 2012, that segment is increasing. Another way of looking at our portfolio for Seek, Test, and Treat is to have these Venn diagrams that depict where there is, what component of the Seek, Test, and Treat the different projects are actually addressing. If you look at high-risk groups and where are we investing our resources in terms of implementation of Seek, Test, and Treat, we have six projects that are focusing on addressing the MSM epidemic in the United States, which is by far the fastest growing, especially in young minority MSM. And we have 18 projects that are focusing on IDU and 5 heterosexual. The nature of these projects are also listed here below. In terms of ethnicity, a majority are addressing the African American population, and we have a sizable number that are also focusing on Hispanics. In age, we have 5 focusing on youth and 3 on women, and these are the issues that they're currently addressing with regard to those populations. If you look at if you depict the investment and the number of projects that we have domestically, this is what the map of the United States would look at, with most of it being in the Northeast and the South. Globally, we have a presence. We're going to be increasing our presence in some of these areas. Obviously, it's countries where drug abuse and a lot of the injection drug use is driving the epidemics, and that would include Central Asia, Eastern Europe, Southeast Asia are areas where we currently have investment, and we also are planning to expand those activities in those areas. Future directions. One thing that drives how we approach this issue is that everyone recognizes that HIV epidemics are local phenomena. You got to really know your local epidemiology in order to adequately address the problem. And that's why the cascade is one tool that is something that we want to look at. How can we implement that better in specifically addressing and looking at the profile of the cascade for, let's say, different areas, different risk groups, different age groups. It's going to be varying tremendously along those criteria. If you look at just youth in the United States, there's 60% of the young MSMs that are unaware of their diagnosis compared to 20 in the general population if you look at national data. So there are significant differences that would alert you where you should be investing your money in order to have some impact on the local epidemic. Some of the major problems we have with treatment as prevention domestically is basically delayed in testing, especially for injection drug users and other non-injection drug user population. We are diagnosing them late in their disease progression. The delay in engagement and also the early dropout, especially drug abuse, has a severe problem with retention. That brings us to where we're going to be looking at investing some of our money for new research projects in the coming years, using, like I said, the cascade of care as a tool for public health in terms of better diagnosing where we should be investing and interacting, and doing service or implementation research, trying to determine what is the best method to do so. Obviously, there's the combination of HIV strategies. There we're talking mainly of looking at HIV and drug treatment, both treatment modalities, for doing a better job at recruiting and retaining people in care. Another area that we're going to be expanding is looking at substance abuse, especially with regard to alcohol. At NIH, the Alcohol Institute has a limited budget for AIDS. The resources that they have available are not equal to what we have, and we felt that it would be beneficial to the entire field if we started dedicating more attention to alcohol. So all future initiatives that will be coming out of NIDA will have a component, especially for HIV, will have a component relating to alcohol use in addition to illicit substances. And we do, by the way, have a substantial tobacco and other legal drug portfolio, but alcohol has a drastic impact on risk-taking and pathogenesis of HIV disease progression, so we want to take a closer look at that. Young minorities, MSM population, like I indicated, is an area that is in direst need of future research project. Another one is homeless population. We also, Carl mentioned phylogenetics and looking at network and trying to map how the virus is moving across different risk groups, including IDU, MSM, high-risk heterosexual, and if the pattern of distribution is equal, is similar, or whether or not it varies drastically from risk group to risk group. And integrating of care is a big area that my boss, the Institute director, wants us to try to do a better job at engaging infectious disease docs into addiction medicine to better address the problems relating to drug abuse, which have to do with engaging them in care and retaining once you got them engaged. For any information regarding what it is that we are doing, that we're planning to do, I would recommend you take a look at our webpage. It is religiously updated every week, so it's not like old information. The old activities are deleted, and we make sure that the new initiatives are provided on this webpage.